Hello everyone, I'm Dr. Zhang. I'm from the first affiliated hospital of China Medical University. Today, we will learn spleen meridian of foot tai yin. There are three parts: the course of the meridian, principal indications, and the points of spleen meridian. First, let's see the course of the meridian. The spleen meridian starts from the tip of the big toe. It runs along the medial aspect of the big toe between the red and white skin and ascends to the front of the medial malleolus and further up to the medial aspect of the leg. It follows the posterior aspect of the tibia and passes through the front of the liver meridian, going on along the anterior medial aspect of the knee and then the thigh. It enters abdomen, reaches spleen, its pertaining organ, and connects with stomach. Passing through the diaphragm and running alongside the esophagus, it reaches the root of tongue and spreads over under the tongue. A branch goes upwards through stomach and diaphragm, then flows into heart. And then principal indications. It includes disease of spleen, stomach, and gynecopathia, diseases of the external genitalia, and diseases of the regions along the course of this meridian. Next one, the points of spleen meridian. The spleen meridian appears at Yin Bai and goes to Da Bao, bilaterally, each consisting of 21 acupuncture points. We will learn 5 of them: 公孙、三阴交、阴陵泉、血海、大横。公孙, it is lower connecting point and 8 confluent point. Location, it is on the medial aspect of the foot, in the depression distal and inferior to the base of the first metatarsal bone. Regional anatomy, medial tarsal artery, branch of the spinous nerve, are around Gongsun. Indications: first, gastric pain, vomiting, abdominal pain, diarrhea, dysentery. Second, insomnia, madness. Needling method, perpendicular insertion from 0.6 to 1.2 cun. 三阴交. Location, it is 3 cun above the medial malleolus on the posterior border of the medial aspect of tibia. Regional anatomy, the great spinous vein, the spinous nerve deeper in the posterior aspect, the tibial nerve. Indications, it has so much indications. First, Bob Rigmer's abdominal distension diarrhea. Second, irregular menstruation, nucria, prolapse of uterus, infertility, delayed labor. Third, spermatoria, impotence, and urethritis. Fourth, palpitation, insomnia, hypertension. Fifth, paralysis or weakness of the lower extremities. Sixth, yin deficiency syndromes. Needling method, perpendicular insertion 1.0 to 1.5 cun. But be careful, This point is contraindicated to puncture in pregnancy. 阴陵泉, it is Hesi point. Location, it is in the depression of the lower border of the medial condyle of the tibia. Regional anatomy, deeper, the posterior tibial artery and vein, and the tibial nerve. Indications, first, abdominal distension, diarrhea, edema, jaundice, dysuria. Second, pain of the knee. Needling method, perpendicular insertion from 1.0 to 2.0 寸. 血海. Location, when the knee is flexed 2 寸 above the medial superior border of the patella, on the bulge of the medial portion of quadriceps femoris. Regional anatomy, the muscular branches of the femoral artery and vein, the anterior femoral cutaneous nerve. Indications, first, irregular menstruation, metrorrhagia, amenorrhea. Second, urticaria, eczema, erysipelas. Needling method, perpendicular insertion 1.0 to 1.5 寸. Next one, 大横. Location, it is 4 寸, lateral to the center of umbilicus. Regional anatomy, the 10th intercostal artery and vein, the 10th intercostal nerve. Indications, abdominal pain, constipation, diarrhea. Needling method, perpendicular insertion from 1.0 to 2.0 寸. Okay, this class is over. Thank you. See you next time.